In this short video, I'll show you how to perform a capillary refill test on your patient. One of the most feared complications is blocking or compromising a blood vessel with filler. This could result in ischemia and, if left untreated, necrosis of the tissues. This may lead to lasting damage such as scarring. Blood vessels can either be directly blocked with filler or they can be compressed by filler, causing the tissue insufficient perfusion of blood. This usually looks like colour changes over time. This is somewhat difficult to diagnose, and we can be more certain by looking at capillary refill. One of the earlier indications of decreased perfusion is a change in the capillary refill time, or CRT, of tissues. You must be able to perform this test confidently to be able to make the first steps in diagnosing an occlusion. Knowing what looks right and what looks wrong will mean you can treat your patients knowing you have provided them with the best care possible. So what is the capillary refill time? Capillary refill time is the time it takes for tissue to return to normal pinkish perfusion from blanching after it has had firm pressure applied to it. In medicine, it is performed on distal body regions such as the fingertips. However, as we are treating the face in aesthetics, we use it to determine whether there is disrupted blood flow in the areas we are treating. The normal capillary refill time is less than 2 to 3 seconds for men and women under 65 years. In elderly patients, this can increase to 4 seconds. How to perform a capillary refill test? You can use your finger or a firm, flat object to perform the capillary refill test. Press the finger or flat object against the skin firmly for 5 seconds and then release. Observe and record the time it takes for the tissue to return to normal colour. Make sure you perform the capillary refill test not only on the treated or affected side, but also on the unaffected or untreated side. So this is what it should look like when you are performing the test. Press, hold for 5 seconds, release and observe both sides. Repeat if needed to confirm both sides are equal or unequal. Bear in mind that capillary refill on darker skin types can be difficult to assess, so you cannot rely on this test entirely. When to perform a capillary refill test? It is good practice to check the CRT prior to starting your injection, so that you know the baseline for that individual patient. If you are checking after your treatment, then that's okay too. The reason you should check both the treated and the untreated sides is because you are unlikely to have a significant difference between one side and the other. Differences in CRT are therefore more likely to indicate a perfusion problem on one side. What happens to CRT in a vascular compromise? CRT of greater than 3 seconds may mean the tissue is not being perfused adequately. This could be due to a restriction or blockage of the blood supply. This is where an artery is blocked and the blood supply has been compromised. A very fast capillary refill time of less than 2 seconds found on bluish discoloured tissue can indicate a venous insufficiency. In the case of blockage of a vein, blood will back up in the tissues and stagnate or pool, leading to a faster refill. Do some people have increased CRT without ischemia? Yes. As already stated, the CRT